my channel. I'm Kels, a third year student ODP. Come along with me, follow me on YouTube as ODP Chronicles or on Instagram, same ODP Chronicles. Without any further ado, let's get right into why you click on this video. So I'll give you tips for your placement, seeing that you are now going to start university to pursue your dream job to become an ODP, just like what I have done 2 years ago. So I'll tell you 10 things to expect or to prepare you for placements. Number 1, arrive early. Number 1. 1, 2, 3, 4, 5, 6. Number 1, arrive early. Let me stop playing. Number 1, arrive early. The best thing is to arrive early at your placement. Once you know which hospital you are going to, make sure that you know where the parking is, if you have to pay for parking or not, so that you won't be faffing about looking for parking. Yeah, so arrive early, get into the change room, because you have to orient yourself with the hospital. If it's a new hospital, yeah, you have to orient yourself. So this will allow time for you to orient yourself with the hospital, know where the change rooms are, and sometimes the change rooms will be very busy, because remember, there are other people who are working there and they have to change in that same change room. The doctors, the anesthetists, everyone change in the same change room. So you as a student, you don't have a separate change room. So get there early so that you can get your size of scrub to put on. That's number 1. Number 2 is make sure that you have a pen. Most hospitals use black ink pen. I know it's quite obvious, but sometimes we really forget these simple things. Make sure you have a black ink pen. It is good also to have a scissors, because most times you will have to be cutting what do you call that, not band-aid, the thing that you put on the cannula. Oh my gosh, as I'm filming the video, I'm forgetting a simple little thing. Tape. You will have to cut the tape. So sometimes this is not a necessity for your first week of placement, but it's good to have a scissors that you can cut, a nursing scissors or so like that. Some hospitals provide you with anesthetic machine key. That's where you will change the oxygen cylinder if the oxygen is finished on the back of the anesthetic machine. So some hospitals have the keys, some hospital I think they don't, and the ODP have to get the key. See what your hospital is, right? But most time you have it there. But that's just extra things. So let me start over. First, get to placement early. Second, make sure you have a black ink pen. Third, make sure when you get to placement, identify who is your mentor. Don't go start working with any and everybody, and at the end of the day you are told that is not your mentor. Go to your practice educator and find out who is your mentor, if you do not have your mentor already, right? 4, make sure that you at least read something about theater. If you have never been in a theater before, make sure you read at least something about theater. For example, you know, in the morning time before every case, the surgeon, the anesthetist, the scrub nurse, the students, the ODP, everyone have to be in a meeting which is called the huddle. So if you never work in theater before and you read something about theater, at least you will know at least how your day will go. So you have the huddle in the morning where you huddle with all these people to talk about the case that you're going to operate on during the day. Then after that, you anesthetize the patient, and then you take the patient into the operating room. Some hospitals, they anesthetize the patient in the anesthetic room, whereas others, they anesthetize the patient in the theater. Depends on your trust. So that 4th one is to at least make sure you watch videos or read something about theater theater proceeding for a day. So when you go, you won't be looking totally lost, because the worst thing you want to do is turn up as a student on your placement. Although you know you never worked in a hospital, you don't want to turn up as a student on your placement and you looking completely lost, because the team will not have no trust or believe in you, if you see what I mean. I'm not saying that they should expect a million things from you on your first day, but this is what you choose, and you should at least be there looking eager to learn, and at least have your eyes open and not looking lost, or like think, you know, you could look at somebody and you could think like, you shouldn't judge, but you could look at people and think, she looks like she don't want to be here, you know. So just put on a good face, basically, right? Number 5. So this is placement, and then I will tell you university tips. Yeah, I have my phone here. I think I had written some things here. Don't panic at all. Of course, don't panic, guys. Don't panic. There are lovely people out there who are willing to help you, and happy that you are joining this field. So please don't panic. So for example, I would say also get a notepad in placement. So this notepad, what you're going to write in this notepad is basically who you worked with that day, the date. Note this on your notepad for the day, the date, who you work with, what theater you work in, and what cases has been done for that day. With doing this, if you have to track back that you have done a competent, let's say your competent was welcoming patient to theater, you can look back in this notepad and say, oh yeah, I had 4 patients for the day and I did welcome them to theater, and I had worked with John Doe on that day. So now you can go back to John Doe and say, John Doe, I worked with you on this day, remember when? If they cannot remember, they can tap into their router and see that they was in that theater on that day because you had it written down. So make sure you have a notepad, write your date, who you're working with, and what theater. So all of this will help you when you going to sign your pad, which has the information on what competent you're supposed to be signed off on. So notebook, key, every day. That come like a Bible, right? Also, so for placement, so let's go on to the book. Wing! Have a Bible. Okay, I'm a Christian, so I just saying have a Bible, but anyway, that's not for placement, right? So yeah, so for placement, there is this card that our risk manager in our trust, he was an ODP, but he's now a risk manager, and he gave us these lovely cards. So I'm trying to get the beginning of the stack. So the name of it is, oh, let me see if I can stand up. Come on, focus. Oh, it's taking long to focus. Common anesthetic drugs, right? And he got it from the perioperative cpd.com. That's what it said on the card. Yeah, also this same website, perioperative cpd.com, they have a lot of certificates and courses that you can do and get certificates, so you can check them out. So guys, so this is good for placement. What it entails, it have all your most common anesthetic drugs used. So it have like IV anesthetic agents, it have opioids, muscle relaxants, and so on. So we know propofol. Oh my gosh, this is not working for me. Propofol is an induction agent, so it's telling you the ampule adult induction dose 1.5 to 2.5 mg/kg, and so on. Ketamine, etomidate, it tell you about midazolam, opioids like fentanyl. Basically, this is a nice pocket card to get. It's from the, write it down, pause the video, get a pen and paper, write it down. It's from the perioperative cpd.com. Yeah, that's one. And next thing, for university, I will recommend this book. This book helped me for my drug calcs. It is Drug Calculation for Nurses, Context for Practice by Kerry Wright. This book was phenomenal. It helped me for my drug calcs exam. I got 100% out of 100%, no cap. This is a good book. Also for AMP, I have a lot of AMP book. I have advanced AMP book, but I find this one was very basic. If you are somebody who never been in the healthcare, it's good to start off with this book. This book is Anatomy and Physiology, made incredibly easy. It is incredibly easy, guys. If you are someone like me who likes to see pictures and colored pictures, this book is your Bible, basically. This book is your Bible. Get it. So it's Anatomy and Physiology, made incredible easy by Laura M. Willis. So this helped me with my AMP exam, which I also passed. I didn't get 100% out of 100% for AMP, but I passed. So this book is very good to have for AMP. Also, you know, as I told you, this is AMP Bible, this is Drug Calcs Bible, this one is Operating Department Practice Bible. So this is Foundation. The name of this book is Foundation for Operating Practice by Hannah Abbott and Helen Booth. Follow me on Instagram if you are not seeing the book properly. I know I was vocal, I said the name and the authors, but if you're not seeing the book properly, follow me on Instagram, ODP Chronicles, and go to my story or my highlights. Basically go to my highlights and you'll see all these books. Yeah, and these books, I have used these books as I mentioned. I bought some books that I never use. For example, I don't know what fly in my head to buy this book. This book is called Medical Terminology. I don't know if I think I was studying to be a doctor. I don't know who I thought I were to buy this book, Medical Terminology. I never used it. Look at it. It's so crisp and fresh. So I didn't use it. I just didn't need to know all these medical terminologies, basically. And you need to know medical terminologies as ODP, but you don't need a book, if you see what I mean. This is a recession. You don't have to go and buy a medical terminology book. Don't do it. Let me be the guinea pig. Don't do it. A next book that I bought and I didn't use, this is a good book. It is Oxford Handbook of Perioperative Practice. This is a very good book, but I did not use it because I think I didn't like how it's so thin, and you know, I won't say I didn't use it. I use it 1% of the time. That's why it has this highlighted page here. What the page highlight? Perioperative preparation. If you are new to theater, buy this book, because what happened, this Oxford Handbook of Perioperative Practice, it will basically help someone who is new to theater. I did not have to use this book because my battery. I did not have to use this book because I was a TSW, so I knew how the theater is run every day, basically. So I didn't need this book. But if you're new to theater, buy this book, Oxford Handbook of Perioperative Practice. Yeah, that's it. My battery is dying, guys.